I'm Dr. Hussam Hawamdeh. I'm the head of structural interventions at Baptist Health. We're now happy to be able to offer a transcatheter aortic valve replacement or implantation in Fort Smith, Arkansas. Previously, all our patients have to travel at least 2 hours to be able to get this procedure done, and now we can do it locally. Aortic valve is one of 4 main valves that we have in our heart. It's the one that goes through the most wear and tear because it deals with the highest pressure difference across that valve. So I would like to tell my patients it's like in your house you have multiple doors that connect multiple rooms, but you have one that connects your house to the outside world. And that's the one that tends to get rusty. That's the one that tends to get the heat in the summer and the cold in the winter. And at a certain point, that door gets very rusty. It doesn't open, and when it closes, it doesn't close all the way. It leaks. Think about how much it takes of strength and energy to open that door every time, and then that your heart is doing that around 70 times a minute, day in, day out, never stops. So with that concept in mind, this is a lot of pressure that your heart is dealing with, and that's why when we get to that particular point, risk of death becomes very high if we don't do anything about it. If you go to see your physician, be it your primary care physician, your cardiologist, they put a stethoscope on your chest, they'll be like, your heart is making a sound that it's not supposed to make. And that pretty much starts our workup, where we get an echocardiogram and we measure the pressures across the valve. And about 90% of the time, that's enough. That's all the data that we need to say this patient has, for sure, severe aortic valve stenosis. They'll either have heart failure symptoms where they can't breathe, there's fluid building up in their legs, in their lungs, and they can't lay flat, they have to sit up on pillows. Some patients will just say, hey, I was able to, go do my grocery shopping, and within the last 3 months, I started getting really short of breath. I have to stop and catch my breath. Another one of them is chest pain. Some people will be like, 3 months ago I was able to do my work in the garden, and now I have to stop because my chest hurts. One of the very alarming symptoms is when people start passing out. So those are pretty much the main symptoms we look at: heart failure, angina, and loss of consciousness. One of my patients who was an avid golfer, and of course any patient who comes in with severe aortic valve stenosis, we offer them either surgical replacement or over-the-catheter replacement. And that particular patient would have done wonderfully in either option. And he looks at me and is like, which one should I do? And I said, I can't answer that question for you. It's your body. I need you to make that decision, but I can help you with one thing. Would you like to golf next week, or would you like to golf in 6 months? Most advancements and most things we can offer in medicine help patients live better. TAVR is one of the very few procedures that actually help patients live longer and live better.